Hi, everyone. On behalf of United Way of the National Capital Area and the entire staff, welcome to Project Community Connect. I am Katie Muir, the Community Impact Manager for Health. United Way NCA expanded its annual Project Homeless Connect in response to the COVID-19 pandemic and to align with its strategic programmatic direction focused on achieving equity for all of our community members, regardless of race, gender, income, and ability. We're excited to work with our partners and community-based organization on PCC's mission to build community, shift mindsets through personal experience and connection, and provide critical resources at no cost to individuals and families in the Washington, D.C. and surrounding counties in Maryland and Northern Virginia. Workshop topics for this week include healthy eating on a budget, eviction prevention and rental assistance, starting a small business, legal services in the areas of expungement and housing, and several others. In this time of COVID, there is no segment of society that has not been touched by this public health crisis, particularly those households who are struggling to afford the basic household necessities, including housing, childcare, food, transportation, healthcare, and even a basic smartphone plan. In this unprecedented time, and as we all continue to navigate uncertainty, it remains imperative that your United Way provide innovative ways to reach workers and their families throughout the DMV. Today, I'm joined by Faith Mitchell, HIV Prevention Coordinator from Mary Center, to bring you sexual health, talk, test, prevent, and treat. Please join me in welcoming Faith Mitchell.
Hi, everyone, and thank you, Katie, so much for that introduction. Like you said, today we're going to be talking about sexual health. And even if you've heard some of these things before, I hope that today I give you some tidbits and some knowledge about where we are today when it comes to what's going on with sexual health in the United States and in our area in particular, as I talking about safe sex or just talking about having sex in general. Talking about testing, prevention, and treatment. So all things surrounding what you can do and what you can teach others to do when it comes to sexual health. So today I'll just be introducing myself, going over some ground rules about how I like to talk about sexual health. And then we'll talk STIs and HIV, and then I'll get into some prevention methods and some resources that we have in the community. So again, my name is Faith Mitchell, and I have a master's in public health. I've been doing sexual health for quite a long time, as Katie said. I'm going into my 7th year in this field, and I really enjoy it. I really think that it's something that everyone should be able to talk about, whether it's with your provider, whether it's with your friends, your kids. It's something to be learned for all levels. So I hope today will be a really good session. 2 things that I always make sure that I do when I'm doing a training section is I don't yuck someone's yum. So a lot of times we may talk about things that a person may do sexually that you may not think is okay. You're like, I would never do that. But you know, everybody has their preferences. Everybody's able to have whatever type of sex they like to have. And you never know. You know, sometimes we say don't knock it till you try it. So definitely don't want to make anyone feel uncomfortable. Always want to be respectful when talking about sexual health and let people really come to the table and ask whatever questions they have. I know that my information will be given at the end of the session, and you can always contact me to talk about anything when it comes to your sexual health and even your overall healthcare, getting help with that too. So let's talk. What I'm going to do is I'm going to present some common known or uncommonly known facts rather about STIs, and then I'll get into some of the nitty gritty when it comes to details about those STIs and HIV. So current statistics, where are we at currently when it comes to STIs in Washington, D.C., Maryland area, which I work? So as of the last report from the Department of Health, there were over 9,000 cases of chlamydia, over 4,000 cases of gonorrhea, and over 200 cases of primary and secondary syphilis in 2019, which I'll get into more detail about that later. There were also, currently there are over 12,000 people in Washington, D.C. living with HIV, and there are 282 new cases in 2019, there were. So essentially, we are still getting new cases of HIV, whether you've heard of someone who got newly diagnosed or not, or you know someone that has HIV in the area, it is something that has high prevalence for an area like Washington, D.C., where we really are essentially just a city that operates in some ways like a state. Now, with Maryland being so close next to us, and it's somewhere that a lot of people are transient. So you have people that are going in and out between DC, Maryland, and Virginia. They are working, they're having relationships, going out to party, meeting people, and everything like that. So it's crucial to know what's going on in the whole entire area, since you can literally walk a few miles and now you're in a whole another place. So Maryland actually is the 12th highest in the nation when it comes to chlamydia and syphilis, and 24th in the nation when it comes to gonorrhea rates. Their statistics were from 2018 for that. Now, they currently have over 31,000 people living with HIV, and in 2019, they had 931 new cases of HIV. So essentially, when you're looking at these numbers, relevancy, you're looking at like 1.8%. You're like, that seems kind of low, but it's actually quite high when you think about what the actual numbers are and how these areas are very high where we live at on this East Coast. So the first STI I'm going to introduce, a not so fun fact about it is this STI was given the nickname the clap. Many stories have been given to explain the name's origin. The most accurate is that to treat it, what they used to do way back in the day is they would take the penis and they would clap it in between two books to release the discharge. Thank goodness we have great advancement when it comes to treatment this day, because that seems pretty painful. And this STI that I'm talking about is gonorrhea. So like I said, over 9,000 cases reported in DC in 2019, and it's a bacterial infection. So I'll go over this a little bit later too, but with STIs, you have both bacterial and you have viral infections. The bacterial infections are ones that can be treated with some type of medication, antibiotics. You may take some pills or you may get an injection. But this can cause infections in your genitals, in your rectum, and in your throat. So another thing people don't know is that you can get some of these STIs in your mouth if you are having oral sex. Often, as you see with other STIs as well, there are no symptoms. However, some symptoms that you may see if you have gonorrhea, you may have painful urination, and you may have whitish, a weird white, yellow, or green discharge coming out of your penis that's abnormal to what would normally happen. So it would just be probably in your underwear, not when you're like having sexual activity, anything like that, and it may have a smell. So those are the things to look out for when you might have a symptom of an STI. Another thing that is not as commonly known is that it can cause infertility in all genders. It is less common in people that have penises, but either way, it can be cause you to become infertile or sterile. And unfortunately, even though you can get the treatment for gonorrhea, if you take too long to get the treatment, that's kind of a long-term effect that you actually can't fix. So that's why we always talk about talk, test, treat. We want to make sure that you're getting tested on a routine basis. Now, the next STI that I'm talking about, this STI is the most commonly reported STI, and it counting about 4 million infections nationwide each year. And this one is chlamydia. So like I said, over 4,000 cases in 2019 can be contracted through anal, vaginal, and oral sex with an infected partner. 75% of infected women and 50% of infected men have no symptoms. So when we're talking about, again, same thing, you may not even know that you have it unless you get tested. Untreated, this infection can progress to serious reproductive and other health issues for all genders again. So we're still talking about pelvic inflammatory disease with this one, which can be a big issue. Difficulty getting pregnant, sterility again. So these are two things where it's like, okay, people think, yeah, I can get it cured, so it's not as big of a deal as other things such as HIV or other STIs that you cannot cure. However, it is really important because if you don't get this treated, you may have lifelong after effects that you really don't want to have to deal with, right? So something to think about. All right, so this next STI is one of the favorites of mine to talk about. Now it has multiple stages, and the tertiary or third stage, well, really the tertiary, we'll get to that, but that stage of that STI can cause painful or ulcers on the face. These ulcers can lead to a condition known as saddle nose, where the bridge of your nose can cave into your face. In the 15th century, no nose clubs were created as supports for people who lost their nose to this STI and some other conditions. This picture is actually a picture of a mechanism where people who had this issue and had this saddle nose would actually wear this so that they wouldn't feel like in public they really had to, show that part of themselves. They were able to have like a fake nose on top. This STI is syphilis. It's often called the great imitator because so many of the signs and symptoms are indistinguishable from those of other diseases. So when I'll talk about this with the stages, but a lot of time people are like, they think they have something else and whole time they have syphilis and they didn't even know it. Now, it can be found on the penis, vagina, anus, in the rectum, on the lips, or in the mouth. So another big thing about this STI people don't know is that it can be spread from skin to skin contact. So even if you're not having any assertive sex, you can still spread syphilis if you have it. And there are 4 stages. Now with syphilis, we have a primary stage. Primary stage is essentially characterized by having a painless chancre sore. This sore can pretty much show like anywhere on a penis or a vagina. A lot of times, like we said, people don't know that they have it, right? So it's painless. You can't feel it necessarily. So if you're not looking down at your genitals and like investigating them, maybe taking a mirror to it to check it out, you may miss this sore. The thing about it is, a few weeks after getting it, it can go away. And that's when you get into the secondary stage. Now, the secondary stage is characterized by a palmar or plantar rash. So that would mean you might have a rash on your hands, or you may have a rash on the soles of your feet. Now, people are like, okay, I would definitely know that I have syphilis if I got a rash on my hands. I would definitely go get checked out. But a lot of people don't have access to healthcare. And a lot of us are very used to having to use our home remedies. We use our home remedies as much as possible. And we try to wait and see what happens before we go to the medical office because medical office costs. Everybody knows all about that type of stuff and systematic barriers, right? So you may take some cream, you may use it for a rash, put it on your hands for a couple of weeks. And just as the primary stage sore, this rash will go away. So after a few weeks of having it, it'll go away. And a lot of people often believe that what they did as a self-home remedy was good enough. And they got rid of the rash, and there's no other reason why they would have had a rash. After that, which is actually the 3rd stage, essentially, is that it can go dormant for years with no signs. So sometimes when I'm in the clinic, I'll have somebody that comes in and they'll have syphilis and they'll be like, they have no idea. They haven't had sex in years. And they're like, I don't even know where I would have gotten this from. A lot of times they have late stage syphilis. And at this point, it can go dormant for years with no signs. Then after that, you get to where you have the biggest issue, tertiary stage. And that's when I talked about having saddle nose, because this stage is when syphilis has gotten so deep that it can affect your heart, brain, and other organs. One of the biggest things is that a lot of people have attributed it to leading people towards having dementia, because it can definitely affect your brain, like I just said. And so you don't want your syphilis to get into this late stage where, again, you're having lifelong effects and impacts on you. And so, again, catching it in like the primary, secondary, even sometimes in the latent stage can still be enough, though, to make sure that you don't have those long-term effects and that you're able to have a healthy sexual life moving forward and not be spreading syphilis or have to worry about anything else with that. All right. So we're going to go now into the viral STIs. So this virus has been known to mankind for many centuries. About 1 in 5 people aged 14 to 49 have this virus. So when you think about 1 in 5 people, that is a lot of people right there. And with that age range, people get it at a young age, and as essentially they carry it on for the rest of their life because you cannot get rid of it. This infection is herpes. So herpes can be transmitted through skin-to-skin contact with an infected person. Many people have herpes antibodies but have never had an outbreak. So when I said that a lot of people have it, there are people out there that don't even know that they have it. Now, if you went to a health clinic, they don't routinely test for herpes because just because you have antibodies just because you have antibodies that doesn't necessarily mean that you will have an outbreak and that you are at high risk of spreading the infection. However, if you do need, you can, get a test and know if you have antibodies in your system, especially if you're having symptoms of herpes, which can be warts. Now, there's two different versions of herpes. One is herpes simplex virus 1 and simplex virus 2. One is what you would think of as like cold sores on your mouth. That would be oral. So anytime you may have like a cold sore pop up, blister on your mouth, it may be attributed to you having herpes. And then symptom 2 is when you have it on your genitals. So that would be characterized by genital warts and warts around that area. Some people have even seen the warts go onto their thighs. And so with that, when you're having an outbreak, you're definitely very likely to be able to spread it. And another thing people don't know is that you can transfer it from one place to the other. So if you have simplex virus 1 and you're having, an outbreak or what have you, you're having sex and you do have oral sex, there is a possibility that you can now give someone, or someone would then have herpes simplex virus 2 because they received it through having sex. And again, if you have oral sex and you put your mouth somewhere that herpes is present, then you may get simplex virus 1 and you may have blisters and warts on your mouth. So that's something to definitely be aware of. Now, transmission still can occur if someone is not having an outbreak. So that is something to consider, but it's definitely something that is less common than if you are having an outbreak. All right, so the next virus I'm talking about, worldwide, about 2 people die each minute of this virus. And so when you think about statistics like that, it's like, wow, that's very striking. But this is a very, very easily transferred infection. So it is very important to understand that, a lot of people don't know about it, but it is a sexually transmitted infection. And this one is hepatitis B. So this one is not often thought about as well. It's a liver infection caused by hepatitis B virus. It actually can be spread through blood, semen, or other body fluids through ways such as sexual contact, sharing needles, syringes, and injection drugs. Now, it can be short-term or chronic, so sometimes it can go away. For other people, it can be something that they have to live with for the rest of their life. Some symptoms can include fatigue, poor appetite, stomach pain, nausea, and jaundice. So all of these things can kind of be attributed to other things for the most part, but jaundice is the biggest thing that a lot of people see. And jaundice is when you may have a discoloration of your eyeballs, and that's when they may turn a yellowish color. So that's something that can often indicate that someone may be suffering from a hepatitis B infection. Now, hepatitis B is the primary cause for liver cancer, and liver cancer is very high on the list when it comes to cancers that people often do pass away from. So it is very important to get Hep B testing, especially if you are, one, sexually active, but if you are someone who is sharing needles, syringes, doing injection drugs, stuff like that, because you want to be able to make sure that you're not spreading it, that you don't have it, and that you're in treatment for it as well. Okay, so the next STI that I'm going to talk about, this virus is the most common STI. So I talked about the most commonly reported STI, but this one is actually the most common that a lot of people deal with. It's actually estimated that 80% of sexually active adults have been infected with one or more strain at a time. This infection is the human papillomavirus, HPV. Now, it could be spread through vaginal, anal, and oral sex, and is said to cause about 99% of cervical cancers. So as we see, this is the leading main cause to cervical cancers that people can have. And as we just talked about with hepatitis B, a lot of people don't even think about sexual activity having a possibility of a long-term effect of a cervical cancer like this. Now, there's no real test, but you can be screened. So if you went to a clinic and you say, I want to get a HPV test, they won't really have an exact test. What they'll do is they'll screen you for symptoms and abnormalities, which can mean internal warts or warts externally, as well as different abnormal cells. So if you, for example, if you have a vagina, you go to get a pap smear, they may be able to see something is off, and then they'll be able to see what else they need to do to determine if you have HPV or any of the long-term effects such as cervical cancer. Now, luckily, with HPV, there is a vaccine. Optimal age to get it is 11 to 12-year-old, and a lot of people ask me, well, especially if they don't think that their child is sexually active at that age, they're like, why would I get them vaccinated? Well, that's because you want to be able to protect yourself before you actually come encounter with anything. The best time to get the vaccine is before you've actually been exposed to it. And so the younger you are when you get it, the better chances you are that your body knows how to fight it off, and that you're able to not have any long-term effects, and it'll go away on its own. All right. And the next thing that I want to talk about, this virus can be on your system for up to 10 years and show no signs or symptoms. For 10 years, no signs or symptoms at all. And that is HIV, human immunodeficiency virus. So it can be spread through vaginal fluids, semen, blood, and even breast milk. It cannot be spread through saliva, close contact, hugging, and small types of kissing, nothing like that. There is no way to visibly see that someone has HIV, especially not today. So a lot of people attribute being HIV positive as something negative and stigmatizing, as like, oh, I'm this that person is dirty or something like that, or I'm versus clean. Having an STI or having any type of infection when it comes to your sexual health, that doesn't have anything to do with your cleanliness or you being dirty, anything like that. These are just things that are out there and that can happen to anybody who's sexually active. So you want to make sure that you're getting tested and that your partners are getting tested so that you all know your status before you engage in anything. Now, in DC, young people aged 13 to 24 account for 20% of new cases when it comes to HIV. And so that's a pretty big number. That's a large chunk of the percentage of people who are becoming HIV positive. And then in DC, when it comes to some more statistics, 1 in 4 of the people who were newly diagnosed were Black heterosexual women, and 31% of those people were men who have sex with men. So those things show that there's a disparity when it comes to certain communities. There's a disparity when it comes to young people, a disparity when it comes to Black heterosexual women, and there is a disparity when it comes to Black MSM. These are groups that are definitely heavily affected by HIV and the epidemic that we have, especially in Washington, D.C. Now, when it comes to HIV, there's a lot of different ways that we talk about prevention, but there's one thing that a lot of people don't know is that U equals U. U equals U stands for undetectable equals untransmittable. There was a time, especially when the epidemic started, that there was no hope, and a lot of people passed away after they were diagnosed with HIV because there weren't a lot of options. But today, we've gotten to a point where some people are able to get their viral loads so low by using medications that they can't even spread HIV to other people. And that's another prevention strategy that's definitely a goal, and why we say that treatment, testing early is a really great thing for everybody, because the earlier that you detect anything, the greater your chances are that you're able to treat it, control it, and manage it, and live a healthy life, and continue to have a sexual health that is positive for you and for everyone that you engage with. So like I said, treatment. Bacterial STIs can be cured, cause no long-term issues if they're caught early. So those are the ones that we talked about. We talked about gonorrhea, chlamydia, syphilis, essentially. Those are the main when we're talking about where you'll come to the clinic and you might get a medication prescribed to you. You may have to get some type of injection as well. But depending on what you have, that's what you would get. Now, viral STIs can be treated to decrease the symptoms and the health issues that you may have moving forward. So those are the ones when we're talking about you having HIV, herpes, HPV, and hepatitis. Those things may require you to get on treatment so that you can manage them. So prevention. Now, most of these things you may have heard about. We have HIV testing, we have condoms, and I did just talk about U equals U. But there's a lot of things that you can do to make sure that you are preventing yourself and others from getting sexual health infections. Now, HIV testing and STI testing as well. Don't want to forget that. Testing is very important. It's very easy, especially living in Washington, D.C. There are centers all over the city where you can get a free HIV test, and it will probably take less than 10 minutes between the time that you get your test and your rapid result. And so that's a really good thing, because at any point in time, you can know your status and know what you have or what you don't have and how to continue to live a healthy life, like I just said. STI testing as well, we can do throat swabs, rectal swabs, and urine samples. So if you're not offered a rectal swab or an oral swab, then you definitely want to reach out to a clinic such as Mary Center that does offer that, because there are a few places in the city that still don't offer it, even though that's the best thing for a comprehensive testing schedule. It's easy. Most of the time, you're going to do your own swab, so you don't have to worry about anyone, doing it for you, it being super uncomfortable. You'll go in the bathroom, you can swab your mouth if you have anal sex or, vaginal sex, anything like that. You can do urine samples and different types of swabs to make sure that we know exactly where your infection is and exactly how to treat you. Now, we have PrEP and PEP. So these two things stand for different things. PrEP stands for pre-exposure prophylaxis, and it is a medication that is used to prevent HIV. Yes, we are at a point right now where you can take medication, and if you're on the medication, taking it as prescribed, then you're able to fight HIV. If you're exposed to it, then there's less than a 1% chance that you would actually become HIV positive if you have these medications in your system. Now, they do work a little bit differently for everybody, depending on if you have a penis or vagina, depending on what type of sex you have, because there's different medications for different type of people. But no matter what type of sex you have, no matter what your gender is, your gender identity is, you are able to take PrEP and you are able to prevent HIV in that manner. It's a once daily pill, so it is something that you have to keep up with every day. But a lot of people are able to do so. There are a lot of people in Washington, D.C., especially, that are taking PrEP and they love it. They think that it's an addition to your sexual health game. You still have to use condoms, because if you do get exposed to other STIs other than HIV, then you won't be protected from those. But when I say that, a lot of people are like, well, then why would I use it, right? We know that in reality, although we talk about condoms a lot, some people just don't use them. They may not use them because they don't have them. They may have forgotten it at the time, or it may break when they have sex. So when I think about an added layer of protection, it's there for those times where you may not do what you intend to do or what you think you should do. You may not use a condom, even though you're saying, I always use condoms. There may be those moments where you don't. That's just something to think about. But essentially, PrEP is there for anything. It's there for those times where you may have had an exposure, you're not sure, but you know that you're protected from HIV. And that's what PEP is also there for. It's just not something that you take on a daily basis, though. It's something that you take in case of emergency. So PEP is kind of like it is essentially an after pill. When you take PEP, it's post-exposure prophylaxis. So it's after you've been exposed to HIV or after you believe you have been. Some people are not sure. So if, for example, if you had an encounter where you had sex with someone, you didn't know their status, you're just not sure. Or if you are someone who may be a survivor of sexual assault, you're just not sure what could have happened during that encounter. And so you want to make sure that you're protected. So this is for people who aren't currently taking PrEP, but they get into that situation where they're not sure if they were exposed or not. But either way, they want to make sure that if they were exposed, they don't get HIV. Now with PEP, you have to take it within 72 hours of that encounter. So the earlier, the better. Like if you had sex today, you want to make sure that you contact the clinic and that you get that medication today. If you're not able to do that, you have up to 72 hours to get prescribed the medication and to start taking it. Now, a lot of health clinics that you may go to routinely, including Mary Center, are closed on the weekends. And so if the place that you want to go is closed on the weekends, you are able to go to the emergency room and they know how to prescribe it as well. So you always will have an option when it comes to taking PEP. Now, condoms. Condoms are still a thing, and people do still use condoms today because they're used for everything. I mean, they can help prevent you from getting sexually transmitted infections. There's even condoms, insertive condoms, that are good for skin-to-skin contact. A lot of people don't use them, but if you notice, when you have just a regular external condom, there's still areas of the genitals that can be exposed. And so you may still have some skin-to-skin contact that you have to worry about. So there's condoms that can protect you from all of that stuff. Condoms still work. they're still a good option and they're still good for everybody to use. So even if you have an allergy to latex, there's latex-free condoms. There's all types of condoms, shapes, sizes, flavors for anybody. And so you can normally get those at any health clinic, especially those such as like Mary Center, there's Whitman Walker, there's Us Helping Us. There's so many places that you can go, even the DC Department of Health, a place that you can go to get condoms. So you don't have to worry about price or cost at all times. You can always find somewhere that you can get free condoms. And then again, talk about U equals U. U equals U is a game changer, especially when it comes to HIV prevention and treatment. When you think about having an infection but not being able to spread it, that's the greatest thing, right? That's a lot of people's goals, is to be able to have a healthy sexual life and they can't spread it. So when you think about having PrEP and U equals U in combination together, that is a really great thing. And I think that it can be something that'll lead us towards ending the HIV epidemic, as all of us have a goal to. So when it comes to resources, now Mary Center, that's where I work. So of course I know all about Mary Center and our services that we offer. Now Mary Center is essentially a health center overall. So what we have is medical care, and then we have branch off services for that. For example, this phone number I have listed is actually an appointment line in general that you can call, but we also are doing COVID-19 vaccines if you want to get vaccinated, and we help with insurance navigation. So if you do need a primary care, it doesn't matter, where you live in the city, in the area, you're able to be seen in Mary Center. We have locations in both DC and Maryland, and we're able to be there for you. And if you don't have insurance, that's okay. We have a sliding fee scale, or we can help you sign up for insurance. Now, in regards to my team and what we do, we have plenty of sexual health services for you. We have PrEP and PEP. Mainly, you'll talk to me if you want to get PrEP and PEP, but my whole team is well-versed and they know how to help you if you need any of those services, as well as we have HIV testing and STI testing. I'm sorry I didn't list that as well, but we do all the tests. We do gonorrhea, chlamydia, syphilis, we do hepatitis B, even hepatitis C. And there's a few more that we're able to do depending on what your needs are, especially if you present with symptoms. We're able to do treatment. So if you do have an STI, if you do have HIV, we're able to get you into whatever type of treatment that you have. And we can do all types of education. So I can talk to you, I can talk to your family, your friends. I can talk to anybody about this conversation that we had today and going even deeper and having different off-brand topics when it comes to sexual health. But these are all the services that we offer, and these are a couple of our phone numbers so that you can contact us. Some other really good things to know. There is a PEP, a PEP hotline in Washington, D.C., where you can call 24/7 if you need PEP. So if you have an emergency, if you may have been exposed to HIV, you don't have to worry that some place is closed. We have a 24/7 hotline that was launched by the DC Department of Health that you can always call and you can get PEP no matter what time of day it is. It could be 3 a.m. like I said, and you always have a resource, as well as a DC Rape Crisis Center. They have a 24-hour hotline. They offer counseling, outreach, and education as well. So these two are really good resources for anybody that may need them, and having them available at all times is super important. The other thing that I wanted to talk to you all about is syringe exchange. So a lot of times people don't talk about this, but it's very important, especially when I brought up hepatitis and it's, easily spread through injection drug use and sharing needles and stuff like that. So if you need your own needles or you need to exchange them and you get new ones so that you're making sure that you're not spreading anything or using other people's needles, there are different various organizations that do help with that. These are just two that I know about that are kind of in two different areas. We have HIPS, that's in Northeast DC, and we have Family and Medical Counseling Services that's in Southeast DC. So they're mobile, they're out there, and they're willing to help. All of us in DC, we work together to make sure that we can help you live your healthiest lives and especially have the best sex lives that you want to have, that you can have. The biggest thing when it comes to having a healthy sex life is to knowing your status and making sure that you're checking up on yourself and making sure that you know your partner's status as much as possible. Now, thank you so much for listening. And if you have any questions, feel free to contact me at Mary Center. Thank you.
Thank you so much, Faith, for that great presentation. It has been a pleasure to have you with us today. Partnerships such as the one with Mary Center are critical to moving the work forward and ensuring that your United Way can meet the needs of the community and that together we can provide the best and most needed resources for the region. Thank you all for attending today's workshop. To learn more about what United Way is doing to mobilize and make bold strides until we achieve equity for all in our community members, regardless of race, gender, income, and ability, please visit unitedwaynca.org/PCC. Thank you all very much, and I hope that you have a great rest of your day.